Alrighty, here we are again at the my blog, the ITSM brief, Information Technology Service Management brief. My name is Manuel Lloyd. Today I'm going to talk to you about social media, um, specifically for medical practices. I know a big fear out there is HIPAA violations. Wanting to make sure that you don't have any. So what I'm going to do is kind of give you a little bit of a guideline on how it can help you. Now, you need to speak with your lawyer in your IT department or your CIO or your IT consultant, or you can actually call me as well and get some guidelines on HIPAA and social media. So let's get right into it, shall we? Um, if you've been listening to my video blog or presentation blog or whatever you want to call this, ITSM brief, altogether, we are about a 27-year-old IT consultancy specializing in ITSM for strategy, design, transition, operation, and continual improvement. And one of the things that we strive to do is take IT at a management level versus a technical level so that you have critical success factors that can be met through KPIs that are easy to understand, key performance indicators that are easy to understand for management, and take it down to a technical level if you need to. So let's go right into it here. These are the 9 benefits of social media marketing for acquiring new patients and keeping existing ones. And the reason why I put that in there is because with macro coming along here, quality-based outcomes, performance-based outcomes, you're going to be basically judged on like a Yelp system coming up here in the future for healthcare. And you're going to want to watch your social media, and you're going to have a social media management mindset, because people will say things that may not be true, that may be true. You're going to also want to make sure that you understand what's going on in your world and in the practice that you practice, in the field that you practice, whether it be dermatology, OB, internist, whatever the case may be, chiropractors, dentists. It doesn't matter. Social media marketing provides a way for your medical practice to increase quote unquote word of mouth advertising about your patient care, and hopefully quality patient care. Word of mouth has always been a powerful method for promoting healthcare. Who's your doctor? How you like the nurses? How do you like the staff? And before social media, people would just talk to each other. Now they put it online where the whole world can see. So you want to take this seriously. Think about it. When you need a new doctor for your child, do you trust the advertisements in the newspapers or the phone book, or your friend who tells you how great their doctor in a medical practice is? You're more than likely going to trust your friend. Social networking, it makes it possible to establish relationships and build trust online, which allows medical practices to indirectly market their healthcare services to potential patients who are more receptive on social media. I mean, everyone has. I was talking to someone, and they were trying to be, clever when I was telling them something. They said, "Well, everybody doesn't have a computer." Right then and there, he let me know that person was not in the know about how social media really works. More mobile devices are being used for social media than anything. More mobile devices are being used for almost everything nowadays. We're in a cloud first, mobile first world, and you need to remember that. You don't want to be caught behind the eight ball when it comes to social media, especially with new guidelines that are coming down for healthcare and patient portals and things of that nature. And people just talk. I mean, they just talk. People are more trusting of social media sites than there are some traditional websites, because the users feel that there are fewer people who would have something to gain by reviewing and recommending another product or service. Now, you do have, excuse me, You do have, and this is crazy. You have these people out here that hire folks to go out and say bad or negative things about you. So reputation management is one of these things on the list here, but I'll get to that in a moment. But you want to be mindful of these things and aware. Awareness is a key to start. So it's crazy. I just cannot believe that people have nothing better to do than to have someone go out on a social media website and say something negative about their competitor just because they're not creative enough to do better. So social media is going to offer a lot of marketing benefits that you'd be hard pressed to find in other forms of marketing. For instance, brand awareness. As more people see the name of your medical practice and the link to your website, your logo, and all that good jazz, and found on social media profiles, you establish more brand awareness among potential patients and your existing patients. So you want to build that brand. You know, Band-Aid, you probably heard this story a million times. Band-Aid is a brand, you know, but Band-Aid is not the actual device or the little strip that you put on. That's the brand. But because we've heard it and seen it so much, we call it Band-Aid. And they've made it that, you know, Clorox. You know, give me some Clorox. Well, Clorox is a brand. So you want to get your brand out there and be consistent and have brand consistency across all your social media properties, right? So, excuse me, brand awareness is going to be so inexpensive to do on social media, and you can get more views than you would on a billboard or on a sign outside or whatever the case may be, because more people are using their mobile devices. They take them with them everywhere they go. I know I sleep with mine. You know, you sleep with them. So think about brand awareness. Number 2, trust. You know, trust is going to establish, or at least be established through natural connections and relationships that develop in online communities. You want to create your own blog, your Twitter community, your Facebook community. You know, it's not used that much that I know of, but even your Google Plus community. Any social community is going to be free. You know, even LinkedIn is free up to a certain point where you want to get more sales savvy and looking for, you know, people to work for you. But these are free tools, and you'd be nuts not to use them to help yourself with your brand awareness and your trust and all these other things I'm going to talk about using social media. You know, when you begin to communicate back to patients or current patients or future patients, again, with the caveat, you're not doing anything to violate HIPAA by talking about, I mean, just like you wouldn't do, I saw a little cartoon where the druggist said, "Hey, Mr. Such and Such, your prescriptions are ready to treat your X condition." You know, and it's funny because I've actually been to places. I actually saw a Facebook page of a medical practice where they took a picture of a little baby by the medical records. And, you know, you think, oh, that's cute. And the caption was, "Yes, the baby works as hard as we do." Problem is, those medical records were exposed. There were some medical records that were exposed, and you blow the picture up big enough, you could see a little bit of stuff. Now, that's just really outrageously, I'm going to say a word. It's just crazy. Why would you even do that? So that's just common sense. Just as common sense. So you want to build trust. Number 3, web traffic. If you don't have any, this is how you start getting it. If you don't have a web tracking monitor or web traffic monitor, build your WordPress website and download plugins that show the statistics. There's different third-party tools out there that can tell you, but the numbers don't lie. You want to look at those numbers. You want to understand those numbers. You want to understand the click-throughs, the impressions, you know, the pages that they left. All of those things come involved with web traffic. Your practice website will gain more traffic from niche conversation on social media sites and groups and blog comments than anything else. So you definitely want to take advantage of that. Again, this stuff is free. You don't have to pay for a service. I mean, you still have to put time in, or someone has to put time in, but you don't have to pay for the service. Number 4, search engine optimization. Well, everybody says, oh, well, I got an SEO guy or gal, and I know SEO and this and that. Well, I like the word search engine marketing better than search engine optimization, but we'll go with this SEO. It's going to increase the number of hits possibly, or traffic that you're going to get. Increasing the number of high quality links to your website, though, that's what's going to get you better SEO. It's like, who's the more popular dentist, ABC or XYZ? Well, the more links that XYZ has than ABC dentist, guess what? XYZ dentist is going to be more popular, and more people are going to look at that dentist and be inclined to go there. So you want to take advantage of SEO as much as you possibly can. And there are some great companies that you can reach out to that can help you with this. Number 5, visibility. That is so important, because a lot of a couple of thoughts I have on this one. A lot of medical practices websites that I see or that I don't see is because they feel like they have enough patient base that they're going to be having that same patient base forever. I highly recommend you look at the term churn. That churn is going to hurt you down the long run if you don't keep the momentum going through social media and online communities. I can tell you that right now. Healthcare is moving more toward a cloud-first, mobile-first environment, and people are getting connected through social communities. So increased visibility in search engines is going to boost the number of visitors who find your website when searching for keywords related to your industry. So when you build your content, the visibility of that, in other words, don't just write a bunch of gibberish. Make sure that you are writing information that has the keywords built in, not just, I'm going to put these in the meta tags or the tags or whatever the case may be. No, when you write the content, if you are a dentist, if you're a medical practice that practices 6 foot tall and above bone treatment, I'm just making something up right now. Don't say we're a medical practice that treats bones. You should say we're a medical practice that treats 6 foot tall and above bone structures. You want to be very specific. Write that in your content. And by the way, more video is better than words. So if you can get video content on your website, you're going to get more attention through video. So visibility is important. And if you're going to be out there on the internet and you're going to have a website, make sure it looks nice. Whatever you show, it reflects on you. I'm just amazed at how many horrible looking websites and horribly updated websites that are out there from medical practices. I wouldn't go there just because it tells me you don't have any kind of organizational skills. I wouldn't put my family and myself in that position, because you're only concerned about a certain thing, and it says a lot about you. So if you're going to have something out there, it's better for you not to even have a website if it's not going to be updated and look nice and professional, I should say, at least. So when you get the web traffic, you want to continue to increase that web traffic by having a following on various social media sites. And it's going to then decrease your dependence on the search engines in general. So you'll have several social websites out there helping to drive traffic versus SEO, because the social drives the links, the backlinks. It drives the search engine optimization. I think my LinkedIn profile gets better search engine results than my actual website, believe it or not. So it's pretty interesting. Number 7, inside information. Your participation on these social media discussions and websites and these groups is going to help you see what's going on with your potential patient market base. Okay. And then you'll be able to find out what people want to see in your services by listening to what they say to one another. So you're just kind of looking and observing and listening, and so to speak. And they're going to tell you what they want. You don't have to ask them. They're going to tell you what they want and what they don't want. I highly encourage you to use rating systems. Now, if you're going to use rating systems like the Facebook rating or the Google rating or the Yelp, please make sure you have your act together. I mean, all of us that are in business, and medical practices is no different. We don't know if somebody's going to say something crazy about us, even though it may not be true. So, and that's a whole nother subject I would get into is how to respond on these social media websites. You should respond pending. Again, you want to be careful with HIPAA compliant issues. So take your time for medical practices that you don't expose patient data or patient information, EPHI. So electronic protected health information. So same thing, obviously, with retailers and credit card numbers and all that good jazz. Just be careful. Sir, your credit card number was blah, 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 and it didn't work. I mean, just think about what you're doing. Number 8, I mentioned this earlier, reputation management. When you're actively involved in social media, you have the opportunity to manage your reputation and not let it be managed by someone else. You can respond to complaints promptly, encourage people to talk about their good experiences with your medical practice, and keep an eye on what's being said about you in general by your patients and by potential patients. Once again, watch what you say and watch what you post picture-wise. You're not wanting to post a picture of a selfie of you and someone in an exam room, and you say, hey, I just treated this guy for diabetes. Just think about what you're doing. And finally, number 9, insight. Social media is going to give you insight so you can discover more about the needs, desires, and trends that encourage your market niche. So your practice niche, if you're, in multi-practice, physician-owned, or even a full-blown healthcare system, it's going to tell you a lot about what's going on. Social media is. So you'll be able to seek or change providers that use this information to fuel your marketing efforts. So depending upon if you're using Google Plus or Facebook or LinkedIn, you're going to end up finding out what's going to be best for you. There are some great advantages of social media. I'm going to wrap up here. And linking strategies. One of the primary benefits of using social media marketing is that you can obtain a whole bunch of links to your website and blog from multiple sources. I mean, you just flood your website with with these links. When you publish a new blog itself or an article on your site, it can be automatically updated through your social media profiles. One tool for this to think about is something called Hootsuite. Hoot Suite, Suite.com. Hootsuite.com allows you to publish, write once, publish everywhere. So, and you can control which social media sites get published what, because obviously Twitter is only going to let you do 140 characters, whereas LinkedIn and Facebook are going to let you do different amounts of characters. But Hootsuite will allow you, and it's free for up to 3 social media sites, and then you only pay like $9.99 after that, and then they have more advanced plans as well. But Hootsuite.com is something that you're going to want to look at so you can better manage your social media presence. As your followers or fans or connections appreciate information from your blog posts, you'll see them announcing it to their followers, to their fans, to their connections, and then you're going to go viral. You're going to quickly go viral. But you got to be consistent. You have to remain consistent with this. You can't just do it today, stop, do it. Get on a plan, get on a marketing plan, a social media marketing plan. There's tools out there, Infusionsoft and even Hootsuite, I think. Infusionsoft is expensive, so just think about that. But I understand it's a great product. I don't use it. I do actually use Hootsuite and a couple of other products and tools, but you're going to end up with a bunch of links to your site strategically placed everywhere your potential client base or your patient base is already visiting online, which means people who are clicking on those links already know those are the targeted prospects that you're already looking for, and that you have relationships with or are trying to get a relationship with. And so, again, it takes time. Obviously, don't get Billy, the the kid next door, to do it for you if he's not committed or she's not committed. Get someone who's committed to social media on a full-time basis. I don't mean necessarily 40 hours a week, but they're doing something consistently throughout the week, because it doesn't take that long. And if you're a provider, if you own your practice, or you're a multi physician practice physician owned organization, take some time to learn how to use social media, and you'll be amazed at the results that you'll get. So anyway, I hope this has been helpful for you. My name is Emmanuel Lloyd. You can visit me online at mwlconsulting.com. And yes, all my social media links are there. You can see us on YouTube, LinkedIn, Facebook, Twitter, the whole 9 yards. And check out our podcasts, our video blogs, our presentations, and things of that nature online. And I hope to talk to you soon. Take care and have a great day.